In other news tonight, nearly 10 months after the BP oil spill, there are new claims that the disaster is causing big health problems. A Louisiana chemist and microbiologist says blood tests show people who are sick were exposed to crude oil and the chemicals used to break it up.
My parents throughout the summer had told me not to get in the water, and me as a young kid, I didn't listen to them because...
But 22-year-old Paul Doom says he spent the summer swimming in the Gulf of Mexico off Navarre Beach. Today, he has no feeling in his left leg and suffers with seizures daily.
In about July, I started getting really bad headaches and internal bleeding. I'd have nosebleeds and whatnot daily.
He says doctors don't have any answers, and worried he could have been impacted by the Gulf oil disaster, he traveled with his family from Florida to New Orleans for a forum on the issue.
Well, we're not finding it in people that eat the seafood, but we are finding it in people that fool with the seafood, particularly when they go out and trawl or catch and they bring up really oily samples.
A chemist and microbiologist, Wilma Subra, is working with people who are sick and say they were exposed to the crude oil and dispersants released into the environment. She's conducted 50 independent blood tests on oil spill cleanup workers and people who live in coastal communities, from New Iberia, Louisiana, to the Florida Panhandle.
Which shows the results and compares it to the normal background. And we have some that are 10 times over the normal background for like benzene, ethylbenzene, and hexane, which correlate back to the BP crude and also correlate to air samples that have been performed in areas where the crude has been present. So the cause and effect is there. It makes the link.
Subra explained the routes of exposure include inhalation, ingestion, and skin contact.
I have those chemicals in my blood, and they also did a urine sample that's showing chemicals. Nobody knows what to do.
I've had nausea, passing out, nosebleeds, vomiting, diarrhea, just you name it. Lost my vision for a while.
Subra says even if people get treatment to remove any exposure, she says they could be faced with a long-term health situation.
Long-term cardiovascular, long-term kidney, liver impacts, and we're having a lot of people bleeding internally because it impacts the red blood cells.
Paul Doom, who had been training for the U.S. Marines, is now confined to a wheelchair and has many unanswered questions.
I don't know. I don't know. I hope it... I hope it's nothing to do with this. I mean, I pray it's nothing. I pray it's fixable.
Dr. Wilma Subra says she has shared her findings with state and federal agencies and says so far she's been told that they are evaluating her data.